We are moving forward for the second panel before the lunch. To invite, I'll start with Dr. Neeta Doshi. I would like to invite Ms. Neeta Doshi, our first panelist for the second, and the topic is the healthcare being future ready, catalyzing change for new India. Dr. Neeta Doshi is from the artificial rain using ion seeding, rain for droughts, rain shadow, and catchment area. A proof of concept for increasing visibility at the runway at Indira Gandhi International Airport, Delhi. Proof of concept, she's into proof of concept for air pollution control in IIT Delhi. Proof of concept to increase the agriculture yield. So she is doing the completed PhD from Savitri Pune University in College of Engineering, Pune. Thank you very much. Our next panelist is Dr. Vishal Gandhi. He is the founder and CEO at BioRx Ventures Advisor Private Limited and chief mentor at Indian Healthcare Angels and Angel Networking, providing a seamless private platform to all the angel investors to invest in early stage ventures. Dr. Gandhi has overall 23 years of experience, of strong experience of deal making in terms of investment, merger and acquisition, and due diligence processing focused on healthcare and life licenses. Thank you very much, Dr. Gandhi. Third panelist is Dr. Sameer Gupta. Dr. Sameer Gupta is the director, Cardiac Cath Lab, Metro Group of Hospitals. He specializes in complex interventional cardiovascular, structural heart, and peripheral procedures. He is the director of Umkal Hospital, Gurugram, the Group Cath Lab Director of Metro Group of Hospitals in Delhi and NCR, and Managing Director of Aurum, Senior and Assisted Living in Gurugram. Dr. Gupta is the host of the popular weekly Health and Sciences. Thank you. Moving ahead, Mr. Kamal, coming from life science and business administration's background. Mr. Kamal has worked from various organizations in India and USA and the Medtopes Private Limited, who is into the business of manufacturing high quality biomarkers for cancer diagnosis, which is into the domestic and export business. Okay. And last, we have the moderator who will hold the nerves to everyone, the moderating the session. Dr. Rajiv Chhibber is the Senior Corporate Affairs, Policy Communication and Media Strategist with experience across several industries including pharmaceuticals, medical devices, and has worked in the past in the development sector in the key areas of healthcare, climate change, energy and sustainability development. Dr. Chhibber is currently Vice President External Affairs at Sahajanand Medical Technologies, a leading developer and manufacturer of minimally invasive coronary stent system. So this is the panel in front of you. Over to you guys. Thank you. Oh my God, I'm sorry. I apologize, please forgive me. Yeah, I'll do it. 1 second. And we have Dr. P.L. Sahu, Director and CEO, National Dope Testing Laboratories, Government of India. Dr. Sahu currently is the Director and CEO of National Dope Testing, Government of India. Before joining NDTL, he served at Indian Pharmacopoeia Commission, Ministry of Health and Family Welfare, Government of India as Principal Scientist Officer and Head R&D. Dr. Sahu, I'll just arrange this chair.
Hello. So good afternoon, everyone. We have a very good panel, and it's a very good mix of people right from the environmental side to someone who's looking at anti-doping, to a clinician, to someone who's looking at investments, to someone who's looking at even, how cancer genomics is going to be the next future. So looking at the entire premise, when we say, and the previous panel was something which talked about it towards the last, but then we need to discuss it more. Being future ready. So we looked at the pandemic. Everyone here, we started our talks with the pandemic itself. We had an entire 2 years grappling with this kind of a disease that we were never thinking of. In fact, we had other instances also. Anthrax were there. There was, Zika virus and other things, but nothing which had impacted a global population. And that is where we need to now think of how are we within the healthcare setup going to be future ready, and how is this going to make us more innovative? Is it going to really take us to another level of medical science, or was the medical science earlier really not future ready? I would not say not being future ready is not is a failure. It's always testing times that one talks about. India, we saw how we grappled with the entire pandemic, but still right from hospitals to providing that kind of a healthcare service to even IVD services being available, to medtech companies really coming up. And at one point of time, there were no kits available, there were no masks, there were no PP kits, and a huge plethora of a gap which we had in the entire medtech sector. But yes, today when we look at it, we are really proud of the fact that we managed to avert a pandemic, and we are at the cusp of what we call ourselves moving to a new innovation ready future. So I'll start off this discussion with Samir. So Samir, you wear two hats. It's something which would obviously give you nightmares when you have two hats. One handling a massive facility as a hospital setup itself, and then the other as a cardiovascular expert. People, were really grappling with the entire setup of how hospitals would be able to provide that kind of a care, and how you as a clinician was able to really catapult or extract that kind of granular details to really look at a fact that are we going to be able to look at innovation and healthcare side by side when we have this kind of a pandemic, or is it something that we really need to change our system and society into? So your views on it.
Yeah, thank you so much, Rajiv. So like you said, I wear two hats. One is that of a doctor, of a practicing clinician, seeing patients every day. And the other is that of a healthcare administrator, right? Where you are, when you are running hospitals or you're looking into the management of a facility. So let me break the answer down in two parts, right? Are we future ready and in terms of healthcare as a doctor? I think what COVID really taught us was how there can be cross-country, cross-geography collaborations, and how we can get data and output very fast. I'll give you guys an example. On 31st of December 2019 is when China reported we have a new virus. Okay? On the 14th or 15th or somewhere in that range, there was a New England Journal of Medicine publication by the Chinese where they came out and said, this is the virus, this is the genome. Okay? Remember, around the middle of January 2020 is when we got to know the genome, and it was published within 2 weeks in a major national publication, major international publication, not national, international publication, right? And the scientists and doctors across the world got into action. 9 months later, we had a vaccine, right? In September 2021 or October 2020 or September 2020, soon after that, we had the vaccine being used in people. Phenomenal, right? As a healthcare professional, it is absolutely phenomenal, the speed at which everybody worked. Even during the course of the pandemic, there were so many different trials that were going on, each testing their own thing, right? So you go back and you see, if you remember initially, there was this thing of chloroquine, right? Chloroquine, everybody was taking chloroquine, and suddenly chloroquine became out of stock, and then it went into the black market, and people were calling me up, Dr. Gupta, can you get me chloroquine? My colleagues in America were calling me up that the flights may shut down. Can you send me some chloroquine? Those doctors over there had no PPE kit, no masks, nothing. They were doctors in New York. I used to live in New York. I trained in New York. I worked in New York. I was calling up my colleagues and saying, dude, what is this happening here? Matlab, chal kya raha hai wahan par? And these people were like, dude, we have no idea what's going on. People are just popping it. We have no masks. If I'm wearing a mask, I'm being told we are going to get fired. So it was craziness. But within 9 months, we had answers. What works, what medicine works, what does not work. That is cross-country scientific collaboration getting answers, right? So we were able to prove that this is possible in 2020, 2022. So I think that is absolutely phenomenal, because now newer drugs which are going to come out, right? I mean, we're talking about COVID. Yes, COVID is a big disease, but I'm a cardiologist. 25% of all people die of heart attacks. They die of cardiovascular diseases, right? 25% of people in this room are going to, statistically, going to have a cardiovascular event, and that is going to be the cause of death. So I think innovation in this field is also coming up at a very rapid pace. Every day, new techniques, new devices, new technologies are coming out. And because of the learnings that we have from COVID, we are going to be able to catapult the efforts into all spheres of healthcare. All subspecialties of healthcare are going to benefit because of the learnings from this devastation.
Yeah. So Samir, talking about that, so I'm right now talking to a Samir who's actually heading a healthcare facility. How would you look at the hospital preparedness now vis-a-vis the last 2 years?
So I think
that's something, because medicines was something which was innovated. The entire hospital setup is going to now depend on how the data that you decipher over the last 2 years is going to make you future ready.
Yeah, so in the COVID, there were multiple challenges all of us faced, right? If I was to break the challenges down, there were basically 3 types of challenges. First was manpower challenges. There were not enough nurses, there were not enough technicians, there were not enough doctors. The second challenge you faced was, so the healthcare goes into the staffing issue. The second challenge that was being faced was availability of medicines, right? We all have faced issues where remdesivir was not being in the hospital. That time it was a medicine which was thought to be godsend. Now we know it is not godsend. It is helpful, but it is not godsend. But that point of time we felt it was godsend. So there were supply chain issues, there were availability issues, and the third was cost issues. Cost issues from the patient standpoint, right? So now I think if we go to the manpower challenges, all these challenges have been recognized. They've been all recognized by the broader medical community. They've been identified by us. And we have now started keeping a certain percentage of our flexible nursing or flexible doctors, or a certain percentage of that, paramedical staff, and some medical staff also, that if there is ever adversity, we can easily tap into these resources and try, and so we don't fall short of manpower, where one doctor or one nurse is taking care of 15 patients should not happen. The second challenge we talked about was in that also, the government is now setting up multiple medical colleges, paramedical colleges. We run a paramedical college. We have nursing colleges. We have a pharmacy college. We have, cardiac technician colleges. So we have about, at any one given point of time, about 3,000 to 4,000 students. So we have also now come out with, smaller courses for GDAs, where, for you train for 6 months, we give you a GDA degree. So a GDA is a general duty assistant, right? So they can reduce the workload of the nurses. So we have identified that, and we are now working towards that. As far as the financial constraints are concerned, I think the government is now really honing down on the Ayushman Bharat to really improve the availability of financial resources for those people who need it the most. And now, especially with them covering the middle class also, the neglected middle class, because the lower class and the upper class are usually people who are taken care of. It is that middle class which suffers. And they are now expanding the coverage of Ayushman Bharat to incorporate that population. So I think with all these things, then, and obviously now we as a hospital and all of us as people understand what to do in a situation of crisis. So when the next one comes, we guys know, okay, this is it. 1, 2, 3, 4 protocols are in place, things are in place, and we're all ready.
No, that's great. In fact, what you basically talked about in terms of solutions is now what we look at the government of India talking about. We are now having a national repository through a digital data itself, the National Digital Health Mission under Ayushman Bharat. So the entire premise now falls, when we talk about future ready, into smart healthcare. So that's where let me change guards and move to Vishal. Vishal, something which today healthcare requires is to be smart in the sense that it is affordable, it is also reaching out to people, and investment friendly. So investment trends in smart healthcare, how would you basically describe it when you talk about being future ready?
Absolutely. So I think let's understand how India healthcare system has evolved. I think our healthcare system is sick care. It's not really healthcare. But now, as the patient is becoming a center, not the doctor, but the patient, So we are seeing that smart healthcare, with the advent of technology, you will see that patient becoming more empowered. And as the patient becomes empowered, there's a need to have the wellness industry growing up, right? So, and wellness industry will grow up only when you have digital tools. And that's one of the reasons we have seen, unicorns like Innovosur or Practos of the world or Pristine Care, who are actually leveraging on the power of technology to deliver healthcare. It's not that the earlier healthcare was not delivered, but it is now delivered in a cost-efficient manner. And if you see that digital healthcare as a subject, did not exist 5-7 years back. But today, you cannot think of healthcare delivery starting from pharmaceutical research and development. I've seen that myself. From to the supply chain, last mile delivery. If you don't have smart healthcare incorporated in your processes, you certainly cannot actually deliver healthcare. You will continue to deliver sick care, and I think it's high time, with India's population of 1.3 billion with a limited budget, and then you have a focus of Ayushman Bharat. I was actually in Ladakh a couple of days back, and it's so impressive that what Ayushman Bharat has done, what National Digital Health Mission has done, but I think we should not be complacent. Of course, there is a lot of development which has happened, but if you ask me, are we future ready? I don't think so. Technology will certainly accelerate us to be ready from future perspective. But in general, I think if you look at dependence of formulation, we claimed we are the pharmacy of the world. Are we really? Tomorrow, China stops giving you API. You are done. You are so dependent upon China on the API, which is a starting material, right? And I think Dr. Bhattacharya did mention about it. Government did propose 15,000 crore infusion to revive API industry. Yeah? But is that going to really help us in the future? Yes, it will, but it will take at least 5 to 7 years, because from dying API industry where nobody wanted to invest in API, I had so many plants I have seen, which wanted to sell off, and we just didn't have buyers. But suddenly, government comes up with this scheme of 15,000 crores getting distributed for API, and you see resurgence interest in API sector. So I think it will take at least 5 years for us to actually call ourselves pharmacy of the world in true sense, because we have not done the backward integration yet. That's one part. Medical device. You look at medtech. 80% was a number when I was a student of biotech 25 years back, that we used to import. Today, has scenario changed? Even after so much of PLIs of the world? Today, 80% dependence. I'm sure Samir can talk much more about this. 80% still is imported. Have we built made in India, make in India? Are we really ready? I think this is another study, I wish somebody could actually do. Have we decreased our dependence? I don't know. Digital health certainly has really, because it wasn't existing. But I think India's capability of delivering smart healthcare is only possible because India has a great access to IT talent. Even Chennai, Bangalore, half of the IT people are actually delivering healthcare for the US system, not for India. But, the talent is there. But are we able to take advantage of them? No. I have visited many hospitals as part of my, job profile. And I see there's no crosstalk between two hospitals representing the same brand. My patient ID exists in Noida, but if I go to the other corporate brand in Bangalore, it just doesn't exist. So there's so much of gap. So when we talk of future ready, I think we are not ready. Even the skill, I think one of the main aspects of future readiness is actually skilling. Are our people skilled enough to be able to employ the usage of IT today in the hospital setting, in the surgery setting? Robotics is an amazing area. I've been supporting 2-3 startups in robotics, somebody who's come up with a substitute of Da Vinci. Now, I don't think our healthcare professionals are ready to actually deal with the robotics, And I'm sure there's a huge scope to do that. So upskilling is another aspect which we are totally missing. So I think we overall need to rebalance, we need to re-strategize and reimagine the way healthcare has to be delivered. And I think if we don't think 360-degree perspective, we will not be able to, live up to the expectation of being a healthy nation. And I think it's important that we think healthy because India does not have that money to take care of 1.3 billion people as of today. And only way is to reimagine, and smart healthcare is the only way to do that.
No, I completely agree with you. In fact, 2 points which I would like to really say that everyone here would agree with you is with the kind of startup scenarios, with the kind of smart healthcare or, the Ayushman Bharat expansion which is going to happen through digital healthcare, we still are 5 years away of achieving what we would like to now think for a future. And that is considerably so because right now our spending, according to the Universal Health Coverage Report, which was released by the then Planning Commission, now Niti Aayog, we still need to look up at least up to 3.5% of the GDP, whereas right now, at this point of time, we are at 1.2% of the GDP in terms of healthcare spending. But that brings me to a next question to you. When we talk about, investments in healthcare, smart healthcare, obviously, we are still talking about the tier 1 cities. We are still not been able to reach out to the tier 2 or maybe tier 3 and the peri-urban and the rural setup itself, which, I was at a conference 3 days back and I heard a very good word by a doctor himself. He said, to reach the tier 3 cities, we need to be phygital, which is physical plus digital, and that is something which we would be going on. However, even if we were to tick box the tier 1 cities in a particular manner, which segment in healthcare is going to be the most attractive segment which you feel is something which we as a futuristic possibility should be reaching out to or leapfrog to?
Sure. See, within healthcare, if you look at pharma sector and biotech sector, has anyway been attracting 100% FDI, So it's saturated, right? Whereas I think medtech as a sector, your own company, I'm sure, is attracted decent amount of money. So I think medtech as a sector is quite interesting because the product development timelines are very little, Of course, you may need to go international and you may need to have 5-7 years of horizon. But if you develop a good product, and I have seen at least 500 products out of BIRAC program, which actually can be developed, can be taken to the market in less than 1 year, But how much market share they've been able to attract is the question, And I keep going back to BIRAC and I've been advising them that, boss, we need to support only 10 innovation, but go all the way so that the clinician like Sameer has a confidence that I don't need to use Bharti's brand, but I can actually use an made in Indian brand, right? I think that adoption, that awareness and the technology confidence that, Indians can deliver a good product at a good pricing, I think that needs to be built upon, and unless we don't do that, and I think we will not be able to attract great investment. And today, medtech as a sector is between all the sectors of healthcare actually has a potential to attract good amount because we continue to import, right? So you have Gs of the world, they are setting up their facility here in India. And of course, that's one part of FDI coming to India. But the other part is private equity investment in some of these young startups, and I'm reminded of this example. 10 years back, I came across this company which was funded by IAN called
Solution for Air Pollution. And that time I was forced to think about the healthcare department, where then I found that the patented technology which I have, how can it be helpful to the common people, and not only common people, but the healthcare people who are taking care of the common people who are diseased and all. You were searching for the masks, you were searching for the sanitization, different technologies. But then I found that mask can only prevent, it cannot disrupt the virus which is there. Similarly, you had ozone technology, you have, UV light also. But then that can be used in the absence of human beings. But then we wanted a technology which can be used in presence of human beings, because once sterilized, it again gets polluted. So it is the source which is to be cleared now. So the source was the atmosphere. And this atmosphere is really, because of the human interference, made very bad, very bad. Now you have vaccinations for the pandemic which was there. But then do you have vaccination for the pure air? You do not have. Now you can find good water, filtered water, alkaline water. You can have organic food, which can be taken for some time. But then what about the air, which you are breathing 24/7? You cannot buy it. So you have some technology role which will play and make this nature, this health, and the atmosphere a healthy one. So the technology played a very good role in this, and I'm really happy that we engineers to have some role to play to take care of the health which we are going for. And specifically, I was more worried about to take the care of the people who are caring the public health. The doctors, the social workers. So they were on the ground, they were risking their life, and I wanted to do that. And so we have this technology development, we have these engineers developing these technologies to see that then we can have this pure earth, pure health for the air which we are breathing together.
No, it was something very important because, when someone like Samir would want his facility to be really, really HEPA sensitized, he would require some kind of a technology which would also give him the faith that yes, it is not going to erupt again. That is where, in fact, today we see on NDTV, or not to mention the channel per se, we see on most of the channels your PM2 levels or your air quality and AQI levels which are being there. It's just to abreast you. So you're not in an alien setup of people who are into healthcare, but yes, you are contributing to it. So that's where, my question is, how would you want to describe that kind of a technology vis-a-vis the entire, assistance to be ready to a healthcare paradigm?
Right, sir. So for that, then with the technology which is developed, like what we say is, everyone might have experienced this. When you go to the waterfalls and mountains, you feel really fresh. So ये researcher का, I am basically a researcher, now converted to an entrepreneur. ये कीड़ा ने find किया कि what is exactly there which we are missing here, and that was the charged particles. When lightning happens, abundant of charged particles are emitted. So then with my technology, I'm having an antibiotic now, which I can artificially generate these charged particles. So these charged particles will do what? I'll generate them in number of size you want, with number of whatever it's required. So these particles will be generated. Now, so you don't have fresh oxygen here. So it's mandatory now that inside an AC you put this ionizers and you will have very fresh and clean air. So I would feel that, sir, you have this to see that the particles which are there because of the vehicular emissions. Similarly, Punjab is very, for Delhi, it is creating a lot of pollution here. So we have that technology which will help reduce and make this clean air, which is healthy. And like to have a mission and a vision, I have a mission to make this Mother Nature healthy, wealthy, and clean. With all of you healthcare people together to see that we are able to reduce the root cause. Because giving medicines is the external source. But then at the source only, if we are able to reduce this, I'll be happy to work with you all. Thank you.
Thank you very much, ma'am. In fact, that's a very important point. If you are healthy, you have a healthy nation also. And a healthy nation is largely the youth of the nation. Dr. Sahu, I come to you on this. we are talking here about healthcare availability, futuristic prospects of healthcare, but all this is going to lie thud if we don't have a youthful population which is really aware and which also talks about being within the premises of careful health, healthcare, in fact. How would you, from a organization that you come from and you head in terms of anti-doping, look at the youth talking about healthcare and you propagating the awareness of healthcare in that kind of a society which is, really chirpy, which yearns to be sport and, energetic in that sense, but still at one point of time fails to understand the right importance of healthcare for a futuristic vision?
Thank you. Thank you very much for good question. First of all, good afternoon everyone, and it's a pleasure to have a part of this discussion. And we all are connected with healthcare directly or indirectly. As Dr. Neeta has developed very good product, and it is very much required at least in NCR. So I heard last time her lecture, and I also seen the demonstration. Maybe today she will demonstrate there also. So you rightly said it is very important to protect our Yuva. I would say Yuva is very important. And in that everybody is working. Government of India is also working very hard to protect our Yuva and prevent. So as you rightly said, this is the anti-doping. Maybe for all of, maybe other colleagues, they will heard first time, but it is a very important topic. Anti-doping, it is the very niche area, very different science, but it is connected with healthcare. It is connected with clinical. So it is very good platform to talk about in this. And we need to work together collaborative. So let me start this, because we have some time and it's a good platform to know you also, because sometimes we don't get opportunity to understand this the topic.
No, absolutely. There's enough youth here. Yes. In fact, I would also like to call myself young enough in that sense. Yes, but yes. Sir, no, I think this is, you could spend around 2 to 3 minutes.
Yes. So the anti-doping science is really the very different science, but it is very unfortunate in India that we are very great in science, in IT, in pharma, but we are lacking in anti-doping science. So now again, as we are developing ourselves in innovative ideas, so it is also good time for anti-doping science, and I am very happy to share with all of you, Government of India is also focusing on that. And last 2 years, lot of focus has been done and lot of work has been done. In next, as we are talking in 3, 4, 5 years, where we will be. And I am happy to share this. At present, the Europe is the center of the anti-doping science and some kind of monopoly, I would say. But Government of India has taken so many initiatives, bringing out the National Anti-Doping Act, which was not there earlier. So by not having any rules and regulation, people were not able to do awareness, education, and we need to connect all the parties. We need to connect the education ministry. We need to connect narcotic control boards. Everybody has to come together, and it is going to happen. It is already started, but it is going to happen very soon. Then only we can prevent our youth. Prevention, as everybody knows, in healthcare itself, prevention is better. Okay, दवाई खाना ही ना पड़े हमें तो ये सोचना है. But okay, this is the critical situation it is required. But as he also said, this wellness. We need to create wellness. Similarly, prevention. So, education, and for example, I am sharing with you this, and you can also share similar with your colleagues and friend in your network area. People should not use any drugs, at least in a sports person. It is very dangerous. People can win the medal, but after 2-3 years, because life of a sports person is very less, very short, I would say. After 30-35 years, they are not able to play. So, if they have been caught, because time is very short, but I would like to invite all of you, please come in my laboratory to see the facility. This is the very unique facility. As I said, this the anti-doping analysis is itself different. It's not like blood sample we have given and in the evening we are getting report. It is not like that. In urine sample, we have to see 600 about substances because metabolites and everything has to be checked in urine. And urine, you can understand the matrix is so dirty matrix. And we have to find out. And the analysis, positive and negative, is very thin layer. We cannot report this the positive till we are not 200% sure, because it depends the life of athlete. If athlete has been reported positive, he can be banned for 4 years. And if he got 4 years banned, he cannot play 4 years, this life is gone. So, at the same time, life of athlete is also very critical. They cannot take anything anywhere. They have to be very careful because it depends on athletes. Even coaches have given direction, आप ये खा लीजिए, आप जीत जाओगे. But coach will not be punished. Only who will suffer? Athlete. So we have to take care of ourselves. So by having this National Anti-Doping Act, even coaches, any support personnel also will be punished, and it is required also. As we know, till we don't have regulations, everything cannot be come through on. Regarding innovation, this is very important. So as I said, at present, urine is being collected. But by innovative technology, in near future, it may be tested by dried blood spot. We were talking like somewhere. So handling urine is very difficult, transportation, keeping at minus 20 degree, always it has to be stored at minus 20 degree to not to degrade, not to get any microbial growth. So, but at the reverse, by having dried blood spot, everything can be done very easily. But again, it is challenge. But challenges bring innovation. If we don't have any challenge, no innovations will be there. So the anti-doping community is working hard to have the analytical methods on dried blood spots. But there are many challenges. We have to detect a nanogram and picogram. And the dried blood, one drop is there in that. And we have to keep A sample, B sample, and like that, the different challenge there, this different amount. But always, similarly, artificial intelligence, it is also going to help in anti-doping science. So what I meant to say, we are investing in research always, but not invest in always in conventional area. About 20 to 30% or 40%, we should anticipate by diverting different out of the box. Like we were telling that after some time, maybe hospital is not required. Just I was listening to the very good topic in the first session. And it may happen after 3, 4 years, 5 years, everything you will get at home. So that infrastructure, whatever is building up, it is maybe not required. It is wasted. So same time, we need to think about 20 to 30% out of the box for then only we can bring out something new.
Sir, as a suggestion, I mean, in fact, this is something which just struck to me right now when it was, when we were having discussions. Why can't your organization tie up with the N number of health and wellness centers which are going to come up with under Ayushman Bharat? And these are going to be, wellness centers which talk about each and every aspect of medicine, whether it's, the allopathy range, Ayurveda, yoga, etc. These could be maybe the catchment areas which you could look at sensitizing, which you could look at even experimenting. So when we talk about 2,300 to 5,000 health and wellness centers being created in the next 3 to 4 years, this is an area which, as a suggestion, maybe your organization could collaborate with the Ayushman Bharat team, catch them young, aware them young, and maybe have those incorporated in a hospital setup so that you may not have that kind of transportation challenges. Another thing which Dr. Sameer also mentioned to you while having discussions is how do the youth, and there's enough evidence that today there's equal amount of dope which is being used in tier 1 and tier 2 cities, and people are as young as 20, 25 years old getting heart attacks and dropping dead to a hospital. That is where the challenge comes to Dr. Samir is, can we get a doping test done on that particular person, and where legislative laws are required? Criminal offenses, can't we have that something which is available to a doctor there and then? And most of the people don't end up even coming to a hospital setup is because of the fear that, okay, I have taken a substance, I have taken a drug. If it is, found out in my stream itself, then what? So maybe, these are some things which you could talk about.
Yes, thank you very much. And you have touched very important subject. Actually, it is required. As I said in my just beginning the discussion, it is not like that what we are sending sample to pathology and everything going to be checked. It is not like that. As Dr. Samir said, sometime we need to go apart from that. We have to do some extra test. Drug abuse. Drug abuse cannot be tested in normal pathology. It is not there in protocol even. So they will say, report is fine, everything looks better. But even though something has happened, so that reason has to be find out. That is very important. In that, of course, our laboratory can play a very important role. And let me share with you, that's why when Act was drafted, I was the part, and I got good opportunity to participate in the drafting the Act. So I purposely put these options because at present our laboratory is the WADA accredited laboratory, World Anti-Doping Agency accredited. And these laboratories, like only 29 laboratories are in the world. So we are not allowed. We are not allowed in other activities. Means it should be said. Even we are not allowed in the testing of supplements. We are not allowed. But this is the very niche area, very important area. So we put in Act that there should be more dope testing laboratory in India, regional dope testing laboratory. And I am sure this after this bill, at present it is in bill condition. When it is enacted in September, October, so after that immediately we have to put proposal, and 3-4 such laboratories going to be, means capacity is building up. That will support for national importance, like even workplace testing is also required. Even in civil aviation testing is required. Who pilots are going, they need to be tested for some kind of drug abuse. Because it is very, I think recently 2-3 months ago, they put in their, they were searching which laboratory can do this test. Even there is no laboratory. But it is very surprise, India having so big country, so big science, so big IT, and unfortunately IT is very good, but when we go in government sector, still it is lacking. They are not up to the mark, but in last 3-4 years, all government sector also coming up with all the facilities, like as you said, data protection. In our laboratory, we have to keep data for forever. Really. And how? So we have 3-4 backup required. Even all data we are putting in cloud server itself. It is always risky. So I am sure this my organization will play important role by protecting the public health and Yuva health. And I am also committed for that. And I have, because I worked earlier in pharma sector, I worked 20 years in pharmaceutical sector. After that in pharmaceutical regulations, now I got this opportunity. Really, this is the entire different world. Anti-doping science is different world. It's just too much, always your mind is occupied. It's a stressed job, I would say. But anyhow, we have to do, somebody has to do it.
Great
so
that you don't have to take any dopes for that stress management. I'll give everyone a rapid fire stress starting from Neeta ji. One solution that you feel is going to have an impact on us being future ready. It's a rapid fire.
Yeah. It's only to generate the particles which will help the Mother Nature to balance, which is, I'm generating that. That is the negative ions which I'm doing.
Vishal?
It will, yeah.
So I think capacity building across all the healthcare value chain, starting from patient to the doctors, to paramedical, to everybody, yeah.
Dr. Samir?
Data. I think data, you said, is the oil. Data is of paramount importance. That is the problem we faced in COVID. What is happening with this virus? I'll just take a minute extra, Rajiv. When the second wave hit, all of us were like, yeah, why are so many people coming to the hospital? This is something wrong. What is going on, right? So we understood that there is something, the clinicians first felt there was something wrong, something is amiss, And then we identified that this is a different variant called Delta variant. This should have been done before. Right? So what we are doing in our hospital, and I am kind of leading this effort, is setting up a massive research department. We are collecting granular level data of patients who are coming to the hospital with a heart attack, where they're coming from, what are the risk factors, anybody in the family who's got heart disease, what is the diabetes, how much hypertension do they have, are they on medicines, what is the patient journey, what are we doing, what is their outcome. So with this data, we will probably get some insight as to why India is the heart disease capital of the world, where we're seeing these famous people. I mean, 25% people are dying, right, of heart attacks. So why are we seeing more of these famous people that we all see on social media, on mainstream media? Can we try and identify some of this? So data is going to be of paramount importance for diagnosis, treatment, and subsequently generation of medications and formulation of government policies in this entire value chain.
Great. This Kamal.
Yeah, I think the technology development, stop import, and stringent QC. Any product that is like famous to like any product that is imported, we always believe the foreign products than Indian products. It's just because of stringent QC that they follow. The same people, Indians, are working in every other country. They are succeeding, but in India, we are not encouraging them just because of stringent QC.
Great, absolutely. Sir, your.
Education and innovations.
Yeah, they need to go hand in glove. So I guess we heard it from all of them, right from having an environmental aspect intertwined to health, to data, to education awareness, to also capacity building is something that would really keep us future ready. And in fact, if I would also want to contribute to that, I would completely agree on the entire aspect of having a data setup which the country will be able to really build upon its healthcare setup. So thank you very much, everyone. And if there are any questions from the audience, we could just give around 30 odd seconds for any questions.
I think we should have question. Interact to it, should we?
Yeah.
Let me make a comment in the meantime.
Yeah.
Well, we are all doing, and I think my co-panelist over here has also talked about it. I think the way Indian products are perceived by the Indian people in India has to change.
Absolutely.
Right? That is a very important, because you were talking about adoption, right? So many patients come and tell me, or when we are purchasing something for the hospital, we are often, the question often comes in our mind, कि यार ये एक US की कंपनी है, ये एक इंडिया की कंपनी है, मैं इस पेशेंट को ऑर्थोपेडिक इम्प्लांट चाहिए. So which one should it be? Should it be an Indian company or should it be a foreign company? And the patient chooses a foreign company. Why is that? Why is the patient not choosing an Indian company? So at some point, we have to generate confidence in the minds of the people that Indian products are equally good. Now, whether that comes from better research, whether that comes from better public awareness, that is all debatable. But we as Indian consumers have to have confidence in our own products, because that is only when this will happen, because we as healthcare physicians, as clinicians, will always want the best outcome, because that patient is not going to care whether this was a foreign product, this was an Indian product, right? He is going to say, the doctor is the face of my treatment. It is not the hospital, it is not anybody else, it is that treating doctor jiske upar ungli uthegi.
Absolutely.
The fingers are going to be pointed on him. He didn't do a good job. He had a bad outcome. He is going to be, various things will happen. So we as the general healthcare leaders who are all in this room have to generate confidence in our own products.
No, absolutely. What Vishal also mentioned was our 80% import dependency needs to really be, shelved off. And this can happen only and only when we have a behavior change, we have a mindset, and also when we have Indian companies who produce a robust set of clinical trials and the kind of medical devices, formulations, APIs, which can really make us more less import dependent in that sense. So I think that is where another future aspect which we can add to it is how Indian mindsets and how Indian companies can really be the next healthcare baskets of the world, and we are inching towards it. When we talk about the PLI scheme, what Vishal talked about, the production link incentive schemes, which have come into many sectors, and especially in the pharmaceuticals and medical devices sector, the idea here is to have a greater export of Indian products and also make us more rich in terms of our own products being available in this country, which are certified, which have robust clinical trials, which have even the kind of prowess which can really catapult Indian companies to be accepted globally. I'll give you an example about my company itself. We are into cardiovascular products and stents. We have been able to really take that particular dent really hard in the initial times, and today I'm really proud we are in over 100 countries. We are one of the preferred stent providers in the entire European Union, and very soon we will be the first company in the entire Southeast Asian region who would have US FDA products against it. So that's something which I would be very proud of. So thank you very much, everyone. We've eaten into a lot of time, and I am assuming there's a lot of people who are looking at the hall outside because it's got some very scrumptious meals out there. Thank you very much, Farooq. It was a very good session, and I think these are kind of sessions which really build upon the entire industry itself. Thank you very much. Thank you.
Very much.